Great. Well, hello everybody. Welcome to our first virtual learning event in the new NHS People Promise Culture series. It's wonderful to have so many of you with us, and thank you for taking the time out of your day today. I'm Louise. I'm a transformation lead in the culture transformation team at NHS England and NHS Improvement. And for now, before we officially start, I just wanted to flag a couple of things to help you engage with our session today. So starting off, as we've got colleagues joining us every couple of moments, it'd be great if you could introduce yourself in the chat box. This is the first in our virtual learning series, and it would be great to start to begin to create a bit of a difference. So please do introduce yourself in the chat box. We're using normal MS Teams format, so I think most of us are pretty familiar with that these days. So you're free to chat and post in the chat box. So please keep it kind and respectful. We want to start with a bit of a conversation in the chat. So in particular, if you could share any thoughts about what you've seen in your organisation, introduce yourself, where you're joining from today. I'm joining from quite a grey Chichester this afternoon. And as I said earlier, my name is Louise. So it's nice to see everybody. We're also going to be using Menti today, so that you can join in with the conversation, because we'd like this to be as interactive a session as we can. So please either download the app now or visit www.menti.com. We'll also be recording our time together today so that you can download the recording and watch back later, or to share with colleagues as well, who perhaps aren't able to make it live. If you can go back a slide, please, Shana. So we're going to be doing quite a high volume of people today. We've had over 300 people registering for our session today, so it's lovely to have so many, and thank you so much for your interest. So as you join, please do pop your messages in the chat box. If you're hearing lots of pinging, it is possible to mute your computer by setting yourself to do not disturb or muting the chat. And also through the wonders of MS Teams, thank goodness for modern technology, we're also able to have live captions available to us. So if that would help you to get more out of our time together today, please do switch them on. Everybody who's an attendee has been set to microphone and camera off. So you'll just be hearing the presenters today. If you can move on to the next slide, please, Shana. As I said earlier, we'll be using Menti. So we've got a code here. You can scan with the QR code or enter the 18826673 code to enter menti.com. And finally, before I hand over to Ronke to kick us off, we're also going to be on, can we go to the next slide, Shana, social media, using our Twitter account and Instagram. We're going to be live tweeting and posting today, but please do join us to build our community and continue the conversation after today's event. It's lovely to have you all with us. And at that point, I'm going to hand over to Ronke. Oh, apologies. I think we've got a couple of problems adding Ronke there. Have you joined us, Ronke? Ronke, I think you can activate your camera now and your microphone. Apologies, folks. Technical difficulties at our end. There you are.
Hello, everyone. I'm hoping you can see me now and you hear me loud and clear. Yeah, it's great to see quite a number of people joining us today, and thank you all for sparing time to hear about the exciting work we've all been doing across the NHS, especially with our culture work. So as a form of introduction, I'm Ronke Akerele, the National Director for Culture Transformation. And with me here are quite a number of other speakers to talk about their experiences on culture, the impact we all can do on culture, and to learn and share with you all on the culture journey that we are all on at different stages. Today is an opportunity to learn from different people. So for me, in terms of my role, it's ensuring that we all are able to combine a sense of belonging in the NHS, whereby the NHS becomes the place we want to be part of, a place where we are able to see the change we want to see when it comes to enabling us to speak up, enabling us to have a voice that counts, and ensuring that participation across different parts of the protected characteristics is also seen in the ways we work. Our culture program does not stand in its own. It's part of other parts of our People Promise. And so I'd like to go to the next slides that just give some context of what the People Promise is and the other speakers. So I think as a starting point, it'll be good to introduce all the other speakers to you. With me here are Professor M. Wilkinson Bryce, who is the Deputy Chief People Officer for NHS England. M has got a varied background. Before joining NHS EI, she's worked across various parts of the NHS in various leadership capacity, and also taken on the role as a chief nurse, including being a chief operating officer and deputy chief executive in Devon. She's also led the Devon STP to ensure that there's closer partnership working across various parts of that system. Also with me here is Professor Michael West, who is my co-chair of the Culture Advisory Group. And for those that are familiar with the culture leadership work and all things collective leadership, Michael is one of the big tanks behind it. And so I think with Michael, there's not much further introduction. His name speaks, and all the amazing work that he's been doing whilst being a visiting fellow with King's Fund and all the beginnings of collective leadership. Also joining me here is Dr. Katy Steward. Katy has been is our head of culture transformation with NHS EI, and prior to her joining, she's worked across various parts of the NHS, leading various culture transformation work. She's also actually lived and breathed our culture leadership program in her senior leadership roles across the NHS. With me here today are two CEOs. We've got Tracy Taylor joining us today. She's the CEO of Nottingham University NHS Trust, one of the largest teaching hospitals in the country. Tracy is an active leader within Nottingham and Nottinghamshire ICS, undertaking several SR roles for key areas such as our planned care, diagnostics and cancer, and provider collaboratives. Tracy began her career as a nurse, and so she values the importance of maintaining a clinical focus as a leader and bringing compassionate and inclusive leadership in everything she does. We've also got Maggie Oldham here with us, who is the Chief Executive of Isle of Wight NHS Trust. Maggie is one of our chief execs that have implemented our culture leadership program, and she can speak to lengths about how that has made a big improvement and supported with their NHS staff survey results. Also with me here are other members of our team, Louise Pramas, who was introduced herself earlier, and also with Sue Burgin, who is one of our transformation leads within the national team, supporting organizations across various aspects of their leadership and cultural journey. Sue is one of those that have been on this program from the onset in 2015 and has played a leading role in developing the program to date. We've also got with us here Abby Blake, who is the interim director of OD at Mid and South Essex Hospital NHS Trust. Abby, after a number of years working within the Acute Trust, doing quite a lot of OD work, she's now joined our culture team, supporting various trusts to implement the Compassionate Leadership Team, Compassionate Leadership Program. Alfredo is one of our workforce program director that has lived and breathed our culture leadership program. He started his career as a clinical psychologist, then moved into the corporate world, working with ExxonMobil Americas. So with our federal's experience, we'll be hearing a lot on what not only has he experienced in the NHS, but various other parts of the sectors. So bringing good knowledge and insights from various other sectors. And all our other culture leadership team are helping to monitor the chat rooms and ensuring that we're moving at pace and scale across the bits. So going to the next slide brings us to the People Promise. And how being an inclusive and compassionate culture is all enshrined into what we want to do. So we know the People Promise is part of what a promise to ourselves as colleagues, a promise to the employer and us as employees, and a promise to ourselves, to managers and their direct reports. So for us, our cultural leadership program would expose and help us to bring to light one of our key People Promise, which is about us becoming a compassionate and inclusive culture. Our other part of the People Promise is also we are recognized and rewarded. When you have compassion over people, you want to ensure that for the hard work we all put into our daily jobs, we're recognized and rewarded accordingly. And as part of that, there are various initiatives that we within the national team are trying to bring into forth to ensure that people have a thorough understanding of what their reward package looks like. We can't become an inclusive culture or compassionate if we suppress people's voices. So a key element of our People Promise is we each have a voice that counts. So all the work that we're doing with our freedom to speak up, whistleblowing, and our staff survey is ensuring that our voices are heard and we're able to use our voices to make changes in the organizations in which we belong to. We are safe and healthy. I mean, if at no time at all, this COVID pandemic has told us the importance of our health and well-being. And so that is quite paramount to ensure that whatever we do, our health and well-being of our staff should be our major priority. The staff we work with are our assets. As an organization and as people, we always want to ensure we continue learning, and there are quite a lot of work that we can do to continue becoming a learning organization. That is one of the feedback and recommendation. The utmost recommendation from the Berwick inquiry is that we need to become a continuous learning organization. And not only do we have to learn as an organization, as an individuals as well. So our Leadership Academy has got quite a enormous package for the workforce to tap into to ensure that we all, at one stage of our career, continue developing ourselves. We work flexibly. That is our vision, to ensure that we enable flexibility by default from day one, to ensure that every part of our system adopts flexible working policies. And COVID has told us that this is indeed possible. We can ensure that we make our work flexible enough to meet everyone's work-life balance. And we're doing quite a lot of work in this area, and it's supporting carers as well to ensure that their desire to be in the workplace as flexible employees come to reality. And we all can't do this individually. We all need to do it as a team. So it's important as the NHS that we work across multidisciplinary teams as needed, and also beyond our organizational boundaries, right? And ensure that we're able to break down those organizational boundaries and move forward into wherever we need to go to. And so that's a synopsis of where the People Promise is. We're hoping that various aspects of our People Promise, there's so many things on our retention hub that'll bring the People Promise to life for people that have not accessed it. And this will give you various offerings from the NHS, from the national system, on all the aspects of our People Promise, and case studies that you can learn from of organizations that have been able to crack bits of those promises. So as I previously mentioned at the onset, the aim of this learning event is to understand why culture really matters. What does culture mean to you and I? What are the latest developments that we've done with our culture and leadership program? How can we be inspired by our CEOs that have joined us today on the work they've done? What can we learn from Tracy, what can we learn from Maggie on the amazing culture progress that they've made when it comes to collective leadership? How can we hear practical experiences from change team members on how our culture leadership program has helped to increase engagement and collective inclusive leadership across the organization? And then I guess it's not just us talking to you, is how do we bring you on the journey? How do you know if you're so excited and motivated by whatever you heard today from my fellow speakers, how can you join the journey with us and bring the culture leadership program into your different practices and be part of that change movement that we would like to see? Next slide, please. And so I think we've got a full packed agenda for today. And so with all the various speakers with me, I'll be handing over to Professor Mike West to give us some opening remarks.
So thank you, Ronke, very much. And hello, everybody. It's a pleasure to be with you all this afternoon. I know some of you are having problems hearing, but please indicate if you can't hear me speaking, and we'll see what we can do about it. So back in January 2020, we were facing a huge crisis in health and social care in the country, with very high levels of staff turnover, intention to quit, vacancies, and the very highest levels of staff stress we had seen for some time. And those problems had been increasing over the previous few years. So when we think about the coming months and years, I think it's really important that we think not simply about how we emerge from this global pandemic, but how we transform our health and care organizations for the future. And that's about culture, of how we transform cultures. And there is real wisdom, I think, in going back to the moment when the welfare state, the NHS, was created in the United Kingdom back in 1948. It was a commitment to create services that would provide high quality care, compassionate care for everyone who needed it, regardless of wealth or status or prestige or background or skin color or sexuality or abilities. In short, it was a commitment to create a compassionate and inclusive society. And compassion, I think, is what has helped us cope during this last 16, 17 months with this global pandemic. The compassion that staff have shown for patients and service users and for each other, and the compassion that the community has shown for people. Over 750,000 volunteers to support the NHS, the volunteers in the vaccination program. You know, the people who kept calling in on my 95-year-old mum to see if she needed shopping or help in any way. Compassion is what enables us to feel safe and a sense of belonging, a sense of connection, particularly in difficult times. And what we always see in human disasters is an upwelling of compassion from our communities. Compassion is something 99% of us are hardwired to show in times of difficulty or when we encounter people who are in pain, suffering, or in fear. And we know a lot about compassion in terms of human behavior, how, to pick up on what Ronke was saying, it increases a sense of belonging and connection, and belonging is so important to us as human beings. We know that when people are asked to be simply empathic to those in pain, that's associated with the activation of pain centers in the brain. But when we're asked to be compassionate towards somebody in pain or fear or distress, that's associated with the activation of reward centers, because we're hardwired, as I say, to connect, to care, to help, to be altruistic, to be compassionate. And we know in healthcare that compassion is probably the most important intervention there is across the board, whether it's anaesthetists visiting patients prior to surgery and being extra compassionate, and that's associated with a lower requirement for patients post-surgically for painkillers and a shorter length of hospital stay, or people with an early diagnosis of non-small cell lung cancer receiving early palliative care in addition to normal early cancer care, extra compassionate care if you like, and the surprising finding they live over 30% longer. When clinicians show compassion to those with long-term disorders like diabetes and HIV, the outcomes are much better. And when clinicians are compassionate to people with mental health problems, there's much better outcomes. And clinician compassion also has an impact on nurses and doctors themselves. So when they're asked to show compassion, their anxiety, stress, and depression declines over time. And the effects are remarkable, greater than the effects of aspirin in the treatment of heart attacks and of statins in the 5-year risk of a cardiovascular event. And inclusion was a fundamental value of the NHS, the welfare state. And inclusion and compassion are like two sides of one hand. They're both about blurring the boundaries between self and other. They're both about connection and belonging. And inclusion is important morally, of course. We know that it also is important in terms of health. If children are excluded from their friendship groups in the playground, it has an impact on inflammation of the central nervous system. When people with disabilities are discriminated against, there are long-term effects on their health. People from minority ethnic groups discriminated day in, day out, it has an impact, a biological weathering effect, if you like. And diversity and inclusion are performance effects. We know that diverse teams and boards, primary healthcare teams, community mental health teams, executive teams, organizations, when they have positive climates, are much more productive, innovative, creative, effective than less diverse or homogenous teams. So inclusion and diversity are not only moral issues and health issues, they're performance issues. And every individual in the health service should have a working knowledge of the research evidence on the effects of discrimination on health. And every leader should have a knowledge of the positive effects of diversity on performance. It's therefore about how we transform cultures in the NHS to ensure that they embody those values of compassion and inclusion that were at the core of the creation of the welfare state. And of course, for every one of us, every interaction in our work organizations every day is an opportunity to shape the culture. How warm we are, how kind we are, how irritable we are, how compassionate we are, how inclusive we are, the ripples spread out and shape culture. But we must ensure that compassion and inclusion are part of every process that we use: selection, recruitment, promotion, appraisal, performance management. They must be built in, those values, to the processes in our organizations, like the DNA of the organizational body. And the program, the Culture and Leadership, the Culture Transformation Program developed by NHS England and NHS Improvement, which I've had huge privilege to be involved with, is precisely the way we bring about that change. And now is the moment. After all we've been through this last 16 or 17 months, now is the moment when we must seize take advantage of the momentum and transform the cultures of our organizations. We can't go back to where we were in January last year, and each of us can take responsibility for transforming culture in how we behave in our work lives and in our personal lives, embodying compassion and inclusion in the way that we behave to others, attending, listening with fascination, understanding, empathizing, and helping. The role of the NHS and health and social care is, I believe, these institutions are the most powerful in our society. If all of the 1.4 million people who work in the NHS go into work every day and encounter cultures that are compassionate and inclusive, they accrete those values, they take those values out back into their communities and their families. And if the 1 million people who use NHS services every 36 hours encounter compassion and inclusion, they take those values back out in their behavior into their families and communities. So there's no more important institution in our society than our health service in England in transforming our society as a whole to be more compassionate and inclusive in the future, and it's what we desperately need. Thank you. And now over to Katy Steward.
Fabulous. Thank you very, very much, as ever. Very inspiring and also very helpful framing of the priority of this session, which is how do we transform culture and how do we use the tried and tested culture and leadership program to help us deliver the People Promise. So first of all, I just want to say thank you to everybody who's tuned in today, because actually you're giving up some time to hear about the program is a real measure of your commitment to wanting to understand more about how we create these more compassionate and more inclusive cultures in the NHS. So I am Katy Steward, and I am head of the Culture and Transformation team. And we run the National Programme for Culture and Leadership. It's a programme which Michael has said has got quite deep roots. But what I want to do today is to just share really a very few comments about our observations from having implemented the programme, and also to try and make this, even this very short session, interactive. We will be going into a conversation with Maggie Oldham, the Chief Executive, who has used the Culture and Leadership Programme to develop her culture and to be far more intentional, if you like, about the kind of culture that she wants to create in the Isle of Wight. And I should just also say now that Tracy Taylor has been hugely important in helping us to shape this session, but unfortunately is no longer able to join us. But please continue to put your questions in the chat, and those questions we'll come back to when we get into the conversation with Maggie. So the Culture and Leadership Programme, just in very headline terms, is a programme for organisations to create cultures that are more compassionate and more inclusive, and also more collective. So it has very deep roots. It was co-designed, if you like, by the King's Fund, NHS Improvement, and the Centre for Creative Leadership. It was piloted in 3 organisations. And we have used it in now around 30 organisations who have used it intensively, using the majority of the tools and honouring the conceptual framework which it's based around. We're also really lucky to have benefited from an evaluation by the University of Manchester Alliance, Manchester Business School, and the University of Birmingham into the programme. And what we've heard from all of that is that the programme works because it is evidence-based. It brings an external perspective into organisations on their culture, and it provides a semi-structured process. So it's in 4 phases, which allows organisations to get started. But why? Why does it help in changing culture? And we don't know all of the answers to that, but that is something which we're really interested in finding out more about and in learning more about. And so what I want to do today is to just share a couple of things which I think, and which I think we all agree, have got some bearing on what it is that makes behaviours change, what it is that makes the way that we do things around here a little bit different. And so I'm just going to say a very brief words about staff engagement, and especially about the importance of listening to staff, about the importance of having a practical plan, and particularly about being really direct on inclusion, and just share with you some findings that it appears that the programme does have an impact on culture. And we suspect that that might be linked to there being a very clear direction from the top of the organisation and support by senior leadership. So to go to listening and staff engagement, we know that one of the most important things for culture change is staff engagement. And allow me to define what that means for our programme. It means, and we observe, staff being listened to, being noticed, being able to talk about issues, concerns in an environment in which they feel safe. And it feels that one of the things about the credibility of this programme is that it does allow for a greater sense of safety. That when staff talk about their experiences of the workplace in the change team, and they're really listened to, and there is real understanding based on data, then they feel that it is all right to raise these issues and raise these concerns. And another feature of the programme is that participation is somehow, because it is above and beyond, staff enjoy participating in this programme because it is doing something different. It is creating culture, it is creating values, it's working with how do we create a culture of care, one in which we all want to come to work each day. And what we saw during COVID was that our change teams became recovery teams. Staff listening, empathising, what is the data telling us about whereabouts during this incredibly difficult time? There are areas for us to help relieve anxiety, stress, and support staff more. So I said I wanted to make this interactive, and I would like to launch a question on Menti. Shana, are you able to put that up for us? So do go ahead and put your questions, enter the code into, go on to menti.com for those of you who haven't. Aha, fantastic. So the question is, who needs in your organisation should be involved in culture change? Everyone. Role model led from the top. Everyone but needs to be led from the top and very intentional. Middle managers, everyone. Absolutely. We know that when organisations get engagement from all staff groups, then there is much more support for the culture change. So there is, that is one area where we think that the programme, because it has this focus on change teams, on workshops, on using culture tools to discover and understand the culture, there is the opportunity for staff to feel much more engaged in much more engaged in the future. So the second point I want to make very briefly is that we are going to do much more on equity and inclusion. And whilst listening is incredibly important, it's not enough. We also have to have leadership which takes a real commitment to act. And you may be thinking at this stage that a commitment to act is something which is very difficult to do around culture, that culture is rather nebulous, that it doesn't lend itself to management plans. But actually our experience, and I think one of the great strengths of this programme, is that it does take people from understanding the culture to developing a detailed plan about what it can do and whereabouts in the organisation there is the opportunity to strengthen the culture. But we are discovering that we have to be much more direct on equity and inclusion. That organisations who have followed the Compassion programme haven't gone very far in terms of creating actionable strategies around inclusion, equity, diversity. And we have a role, I think, to help create much more practical strategies. Is there a vision in this organisation where people really believe that the vision for the organisation is to be inclusive, whether working in systems and as a trust? Are the right things being measured in this organisation so that we can be transparent? Do we know if development is effective? Do we measure the right things in order to know whether our development at team level, senior level, board level is effective in terms of working with inclusion and equity? And all my experience is that, and I've worked fairly deeply in the oil industry, but also in the humanitarian sector, is that organisations find it really difficult to be self-critical. All organisations. and that we have to help organisations to be far more practical. We have to help organisations to be far more direct in their dealing with equity and inclusion. And so we invited Professor West to do a review of the programme with a view to identifying a development in the programme so that we could do much more around equity and inclusion. And he has developed the architecture of the programme so that we have a new cultural element. And that means that a lot of our data, a lot of the tools are being designed so that we can gather more data, which will be helpful for organisations in terms of creating a strategy for going forward. Shana, I don't know if you could replace this Menti question with the next one, please. Okay, fantastic. Thank you. So my final point, and I said I was just going to talk very briefly, is that I wanted to start with a question. And the question I wanted to ask was, would you expect to see a measurable change in culture from doing the programme and changing the culture? Yes. Yes. Sometimes no. Charlotte, could you share the next slide? So So what this slide tells us, and I just want to say that this is early days for us in terms of analysing the staff survey results and the impact of the Culture and Leadership Programme on the staff survey results. What it suggests is that in very simple terms, that heavy users of the Culture and Leadership Programme, by which we mean those that use all of the tools and are somehow loyal to both the intention built into the programme to listen, providing real leadership from senior levels, and honouring the conceptual framework of the programme. What this shows is that those organisations who are heavy users of the programme have a greater impact on their staff survey scores, specifically around these areas of the cultural elements. So the cultural elements, which the staff survey groups are around ED&I, relationship with managers, engagement, quality of care, safety culture, bullying and harassment, and health and well-being. And that the impact is greater than those who are light users of the programme. And the light users of the programme have a greater impact on their staff survey results than those who are non-users of the programme. And not only is it more of an impact, but also the results are less variable. So those who haven't used the programme are perhaps more likely for their staff culture scores to slide back. So we think that there are some important features around using the programme, and some of those are around the role of senior leadership and whether there is a clear direction from the top around the importance of the programme and a real commitment by the senior leaders and by the board to work with what the purpose of the programme might be. So in one of the changes that we've made in the updated guidance that we're going to talk about in a little while is to put more focus on what we now call the scoping phase, which is an opportunity for the board and for senior leaders to engage around what is the purpose of this programme. And some trusts have been very, very, very intentional about the purpose of the programme. How will running the culture programme help us to be a learning organisation? How can we benchmark whether we are in the top 25% of organisations for culture? How do we dovetail our improvement programme with our culture change? So we know that there's a huge amount of variation in terms of how trusts use the programme, and also that we're about to enter a new phase in which, as trusts work as part of systems, they play with the programme and use different facets of it. But I just wanted to surface those three issues, and that brings us to our next session, which is with Maggie Oldham. And I will allow Maggie to introduce herself, but just by way of headlines, Maggie is Chief Exec at the Isle of Wight, and Maggie's going to talk for a few minutes, for 10 minutes or so, and then we'll ask some questions. So Maggie, thank you very much for joining us.
Thanks, Katie, and I hope everyone can hear me. I can see in the chat bar some people have been struggling, but please, if you have got any questions, pop them in the chat bar. I'll be more than happy to answer them during this session, or indeed to catch up with people. It was very nice actually seeing everybody join today, because I've seen quite a few names of colleagues that I've worked with in the past, so it's really lovely to be here. And I was absolutely delighted when Katie and her colleagues asked me to be part of this event today, because I'm such a big advocate of this programme, and I'm such a big advocate of the philosophy that underpins it. And I would say I've had the privilege over the last decade of working in some very challenged organisations, and some people question my sanity for doing some of the jobs that I have done, but I can share with you all today just what a privilege my career has been. So I started off my career as a nurse. I celebrate a very big professional birthday next year. I will have done 40 years in the NHS, and I'm really proud of everything that I have been part of during that period, particularly the last couple of years, with the pressures we've all faced with the pandemic. But my pursuit of compassionate leadership started many, many years ago, well before I really understood the evidence and really the significant impact of running an organisation or being part of an organisation where kindness and compassion was right at the centre of it. It intuitively, to me, felt the right way to behave. And I always say to people, the very best of me is the very worst that I've seen and witnessed in colleagues throughout the 39 years that I've been wearing an NHS badge. But as I got older and wiser in my career, I could actually make those tangible leaps from feeling motivated myself to the impact I could have on my colleagues. And more importantly, I know from my career that when you work in a motivated team, you get great outcomes for patients. Like you, many of you on this call today, you will have two main drivers that make you bounce out of bed. One is to improve things always for the patients, those that use our services. And secondly, your manager and your leaders. And I know in my own career that for some managers that I've worked for, I would always go the extra mile. So swapping off duty, being the organiser of the off duty, you take on more responsibility when those people around you motivate you. And if you do those responsibilities to the very best of your ability, then you start to see great letters from patients and those who use your services. And it becomes a self-fulfilling positive prophecy. And I must admit, over the 40 years I've served, I've bounced out of bed most days. But I also, because I'm a pragmatist and a realist, in those 40 years, I've also worked in certain environments which have brought out the very worst of my personality. So those areas where patients are constantly complaining and become, the everyday is that you face complaints and you're powerless, or you feel powerless to be able to address them. Start to withdraw. You don't go the extra mile for your patients, and you certainly don't go the extra mile for the managers that you believe are allowing you to work in those kind of environments. Now, the easiest thing for most of us to do is just look for another job, especially when we're junior, because we feel we cannot change the culture or the environment. So for me, as I say, I've worked over a decade now in trusts that have got into the doldrums. And when you start this work, it feels like the elephant is absolutely ginormous. Where do you begin? And that's why the programme, as it's been developed, and it's really lovely to hear of the developments within the programme, because it's responding to the feedback from organisations like mine. The structure that the programme can bring you is exactly where the board and where everybody that works in the organisation should be. So in my last two trusts, when I started, I was told quite clearly, oh, we know what the culture's like round here, it's toxic, or we know what the culture's like round here. You won't get anybody going the extra mile here because it's not the way we behave. It's almost like we know it, so we're just going to move on or just accept it. And perhaps if we put a few more KPIs in about performance, and perhaps if we start making people clock in and clock off, and perhaps if we start being a little bit more punitive, then people might realise that they've got to buck up their ideas. And actually, it's just the complete opposite. And the programme allows you to really start to engage, as Katie said. But really, you know, some of these sound like rhetoric words, but they're not. Really to discover what's happening in your organisation, what makes people think in a certain way, what makes people apathetic, where are those gems in the organisation that are really delivering well. And there's a colleague whose name I saw join this call who did a piece of work for me once in another organisation where it was quite simply triangulated 3 years worth of staff survey data, and they were able to show me areas that had done extremely well 1 year that crashed the next, areas that had done really badly suddenly improved. And when we started to look at some of the managers, we saw that in one area where they were having significantly poor staff surveys, we moved a superstar from another area and we put them there. And actually over time, we saw that staff survey go up. But where we'd moved the manager who was perhaps not as well skilled, we saw the opposite effect. So you can tell from some of the tools available to you what your organisation is really like. You know, when you're in that discovery phase, you get to talk about culture. What does it mean? And if every single one of us had the time here today just to put a couple of words on a post-it note, I could imagine it'll take us 2 days to actually share, because we've all got a slightly different take on culture, depending on our personal upbringing or our professional training. And it's really important that you decide as a board, or not so much as a board, but as an organisation, what are the elements within culture that mean a lot to us? And I've worked in trusts where there's a lot of similarities, but there's also lots of differences. And you can only really understand that when you spend time exploring it. Now, I remember when Katie came over to the Isle of Wight for me a few years ago now, I really pulled my face, and Katie, you'll remember this. Do we really need to spend all this time going into this? Look, I can give you the staff survey. It says it's quite shocking. But actually, it was Katie's perseverance with us that actually really made this even the more valuable to us. And I do think the opportunity to talk and hear some of your questions is really important as well today, because a lot of what I'm saying I know will resonate with you, but it's just how do you start, how do you unlock it, and how do you, if you're not a chief exec on this call, you might be thinking, well, it's quite easy for Maggie because she can just say it and do it because she's the top of the shop. But actually, it's really important that everybody who's taken the time to come on this call feels that they can have the opportunity to, if we're going to fulfil the people pledges, that your voice matters, and you get the opportunity to help your board, your senior managers, really shape this programme. Because the other great benefit of following the programme is it gives you that data about your organisation, and your board should look at that information through your sub-board committees, and it's quite compelling when they do see it. You get the opportunity to come together as a board, look at what you've discovered, and design together what you're going to do, what your strategy is going to be. And all those things are really helpful. But the final thing I'd say to you is you will not get results tomorrow. So, you know, the world we live in, people want instant gratification. They want to know, you're doing the programme today, so in the next quarter, will we suddenly see everybody really happy? Will we see the impact of that on patient outcomes, as Michael alluded to? Well, my experience is it doesn't work quite like that. And at times you will feel, oh, is it really worth it? Is it, you know, we're listening to things, we're redoing our values, we've done all of that stuff. But actually, if you persevere with it and you are absolutely determined, you will start to see a difference. I know that because I've lived through it in at least 2 very complex organisations. And I thought I'd just end by reading you out an email that I received on Friday night. So 2 great things happened to my organisation in the last few months. One was our staff survey, and I'm ever so proud and I'm pleased to see the slide that Katie illustrated earlier. We had 60% of our staff fill this staff survey in this year. We buckled the national trend by over 10%. We certainly smashed our previous records. And I'm really proud of the 3 key areas where our staff were saying that they could see the significant areas of improvement, because they were the areas what our staff set as priority. And secondly, we had our CQC inspection last week, because we are a requires improvement organisation. We should have had a visit last May, but because of the pandemic, that was deferred. So, well, there's a long way to go from having verbal feedback to seeing a written report, and I have to be very mindful of what I say, as you will all know from your own trust. Bearing in mind that only a couple of years ago, the CQC feedback, which is public record, says things about this organisation, such as we had 8 core services which were inadequate for safety, and we also had a statement in one of those reports that said this organisation had a blatant disregard for a safety culture. Really hard to read for the staff that work here, but I'm really pleased. I'm going to read you 2 things. One is just a few words that I wrote down on a post-it note from the inspection team, and they said that the inspection team across acute services saw dignified, considerate, bespoke care. There were no patients about whose care the CQC was not confident. I'm sure many of you on this call would really love to get some feedback like that, because I know it's probably made my year. And finally, I just want to read an email that a member of staff sent to me on Friday evening after I'd done a video for staff, just to give them a little bit of that verbal feedback. So obviously I won't name and shame the member of staff, but this member of staff said, I've worked here in this trust for 20 years next month, and I've seen numerous chief execs come and go. I can honestly say that your approach is completely different and a breath of fresh air. You genuinely care about the services we provide our patients and also the staff, who have been seriously overlooked and even oppressed in the past. Working here has sometimes been a huge personal struggle, and I have at times wondered whether the personal cost has been worth it. The lack of respect, professional recognition, and even bullying has been soul destroying over the years, and I've been very close to leaving. When you started, you made a promise that you would change, that the culture in this trust would change, and I hoped rather than believe that that would happen, but you have been completely true to your word. Culture here has changed in the time you've been with us, and the organisation feels like a different place to work. I share that not for personal glory, because those of you who do know me on this call will know that I absolutely hate that kind of stuff. I share it with you because when I first came here, I questioned, could I actually do this? Could we do this? But actually, with the support of this programme, it got us going. And once we got going and got our confidence, there was no going back. So I would very, very strongly suggest that if you do want to change your culture, that you follow this approach. And Katie, I'll pass back to you now.
Fabulous. Maggie, thank you so much. I think we've got time for a couple of questions. We got some really interesting questions in the chat. So the first question was, hi Maggie, how did you deal with the colleagues who are resistant?
Well, it's multifactorial, because one size doesn't fit all. So, for example, the blatant disregard to safety culture, we ran human factors training, and I personally did that training about 10 times because I sat with groups doing it. And then when I was doing it, then the manager said, oh, there's no reason for you to do it again, Maggie, I'll do it. So other people then started to step into that space. And actually, when you do human factors training with a group of consultants or a group of clinical staff, oh my gosh, it's light bulb moment after light bulb moment. So we use that. We've also used our appraisal process. So year 1 was just year of have you had your appraisal, because we were so bad here at doing appraisals. Year 2, and then we've had COVID, and now we're back into bringing that to life. Year 2 was all around, has it been a meaningful appraisal? And this year we're evaluating the appraisal. Do we meet the goals that we've set with our staff? We do an awful lot of, we put a big emphasis on comms and engagement, and we do a lot of videos like with our senior people, and we constantly, I mean, Michael said something, I think, or Katie earlier, about the vision. we bring everything back to those core messages. And many years ago, I had the opportunity to talk to Michael, and he asked me how many objectives I'd set for my organisation. And you know, when you think to yourself, there's a right and wrong answer to this, and I have no idea. So I said, I think we've probably got about 30 objectives. Michael will smile. And I knew from the look on his face it was the wrong answer. And actually, we were then able to take his very wise counsel and bring that down to a very small group of core objectives, which we've stuck to. So I think education, training, perseverance, and actually bringing all your messages back to your core ones.
Yeah. So that's really interesting. There's something in there, isn't there, about those 5 elements of the model, or the 6 elements of the model: the vision, the objectives, the compassion, reflecting and learning together, and working in teams. There's another great question here, which is, how did you know, Maggie, when things were starting to change? What was the earliest sign that you were turning the corner?
I would say to you the earliest times really is patient satisfaction. So when I first started in these last couple of organisations I've worked, the complaint pile's like that and the compliment pile is like that. And again, anybody wants to come and have a look over here, and we've just been able to show this to the CQC. Our compliments are like this and our complaints are getting smaller. We still get things wrong, and I wouldn't want you to think that I pretend over here that we're utopia general, because we're not. But I think listening to patients, you put your impacts into staff, you will start to see patient outcomes improve. And then there's a whole other lot of indicators as well. So you can look at your pressure ulcers, your falls, your documentation, how well the staff fill that in. There's an awful lot of other subtle changes that you can see, especially if you are using making data count, and you start to actually be able to see real trends.
And Maggie, I know you did some work at every level of the organisation, including with the executive team. Are you able to say a little bit about that?
Yeah, I think we've gone on, Katie, as well, to develop some of this thinking across our system, because it's very compelling. People say, oh, when we struggle to recruit some of our bands, we're now not struggling to recruit in the same way, although recruitment is our #1 risk over here, like for many other organisations. But we're hearing people say, word of mouth, you know, my neighbour works for you, she said it's got better, my friend's just been in there, it was a better place. And so we've worked across our organisation with the board. There was a board diagnostic, and it's a little bit painful to do because it really is looking in the mirror. You know, you've got 2 ears and 1 mouth for a reason, and it takes you through that. And it's hard, I think, for people, the execs and other senior people. We want to be on a hamster wheel going fast. And actually this programme helps you get off that and really consider. And we've also tried to apply some of the same philosophies, because there's no point us in health solving our recruitment and then social care comes crashing down around us. So trying to do this in a more integrated way.
That's fantastic. And there is a question here actually, which I think links in really well, which was, how do you get the message out in such a geographically dispersed set of teams? How do you get the message out to everybody?
So it's good team brief. We have a team brief system now where we did an extraordinary one last Thursday for just to update people on the CQC verbal feedback. I think we had over 388 people at one point on the call. So we've got really good, and our normal team brief gets, I mean, we're an organisation of just shy of 3,000 permanent staff. So, you know, to get 10% of your people on those team briefs, I think is a good sign. We have a lot of networks now which have a very good attendance on them, and we keep the messages really consistent. So we've got emphasised, we've got a director of comms and engagement here. We didn't have that previously. We take it really seriously. Their advice to us as a board is just as important as our nurse, our medical director, etc. So we focused on that. We do an awful lot of these video work because we are 4 services: mental health, community, ambulance and acute. So trying to reach everybody isn't easy. We put a lot on YouTube, and yeah, the staff survey indicates that our staff do feel that we've improved our considerably improved our methods of communication.
Probably just time for one last question, Maggie, which is how long did it take to start seeing things change, which gave you faith in the programme?
Well, we've been doing some work with the National Improvement Team for Emergency Care, and they did a presentation for me a couple of, maybe a month or so ago. And actually what they could demonstrate on our emergency performance was that we'd actually probably, just prior to the pandemic, so about 18 months ago, we'd started to show a trend of improvement. But of course, none of us really looked at that during the pandemic. We were all really busy just getting on with, especially very isolated island community. It was just survival, really. But now when we look back at that, you can see that the improvements had started 18 months ago, and we've been able to carry them on through the pandemic, like many others. But we've got some statistical significance around that data because we've got good colleagues, haven't we, across NHS and we've had that support. So I would say to you, this has been a very difficult era with the pandemic to absolutely say for sure. But I reckon 18 months, 2 years is the first indicators that you're getting things right. Another indicator for me was we brought over 125 nurses from the Philippines last year to this trust. Amazing colleagues that have come across during such awful, uncertain times. We've had a 100% pass rate with their OSCEs, and that was something this trust had never been able to achieve before. And again, the pastoral support that's required to help people make that transition, the education and the training in the classroom, but also the reception that they had in the wards. So I do genuinely think probably 2 years is a good barometer.
Yeah, thank you. And I do remember that it is just tough. It was really tough going, and I remember just you saying, we're just going to stick with it. We just have faith. And you really did turn it around, Maggie. And as you're talking, there are so many examples of doing things compassionately. So the support for the Philippine nurses and it is just about dripping this into the organisation in every place that you can, isn't it? And so I just want to make one reflection, actually, which, Maggie, is that for people who lead this kind of change programme, there's something about this combination of having a vision and the humility, no matter how senior you are, which seems to be an important part of this programme. So, Maggie, thank you so, so much for joining us. And I think most people will take this away and will remember it very, very clearly. And just before we break, we're going to take a 5-minute break, so till 4:05. Please use this time to treat yourself, everybody, with a little bit of self-compassion. Try not to check your emails, go for a little walk, get a glass of water, just take a bit of a breather. And we will see you back here at 4:05.
Hello, welcome back, everyone. And it's been an exciting session so far. So much nuggets that we've gathered from all our speakers so far. I mean, we've heard from Michael about the opportunity we have to impact our communities with this work. Every day we have the chance to be compassionate, inclusive, and kind. That really resonated with me. Katie also shared with us the impact that we're seeing as a result of the program and the changes we've made as a result of both observation and independent evaluation. And what a rousing overview from Maggie. Real honesty about the time it takes to do this work. Not just how much impact Isle of Wight has seen as a result now, but it's a lot of great work. I mean, it's very inspiring to hear about Maggie's initial doubts on the program and how later she braved up to it and was able to make the change and bring others along on the program. I think one of the things Maggie said was about having some core messages to always bring back. So when people are having the challenges, those core messages stood out for her and refer other colleagues into those core messages. And I think for me, she spoke about education, and this is what the CLP program offers, the ability for people to be educated on what it really means to be compassionate and inclusive. She spoke about dedication. I mean, this isn't child's play. People need to run the end of time. So it's the dedication, the drive, the determination to bring transformation on culture into all our organizations. And it's about the perseverance. It doesn't happen overnight. It takes time. I mean, it was good to see from the chat a reference to Sherwood Forest Hospitals, who was in special measures 5 years ago, and now they're HSJ Best Acute Trust of 2020. And like in that chat, they say transformation takes years. I engage with Emma Challenge, who is the Director of Culture and Improvement in that organization. And I know how Emma has been very passionate about this, about engaging with us further on what they can do on culture. And not only is Sherwood Forest stopping there, they're quite keen to work with us as one of the pathfinders to test this program across the ICSs as well, because we've done quite a lot of work in the trust, but we want to move it to the next level of ICSs. And we can see that Northeast London CCG is already in that space. So it's how do we bring this further into where we want to go across the systems, working across various organizational boundaries. So we're now going into the second half of today, where Sue and Louise will be going into more detail about the revised changes that we've done to the Culture Leadership Program, and some other team members will be sharing what it takes to implement the Culture and Leadership Program and voices from various change teams. I'll then hand over to Sue and Louise.
Okay, thank you, Ronki. Thank you very much. Welcome back, everybody. My name is Sue Burgin. I'm one of the transformation leads here in the team, and I've been working in and around this programme for about 6 years. Louise?
Good afternoon, everyone. I'm Louise Pramas. I'm also a transformation lead in the Culture Transformation team, and I joined last summer, having worked in the Improving Health and Wellbeing programme and led that for a couple of years. Not an unrelated subject, very much overlap. We'll kind of cover some of the connections to this piece of work later on in our discussion this afternoon, but it's lovely to have you with us.
Okay, can we have the next slide, Shana? So I'm just going to take us through some of the initial changes to the Culture and Leadership Programme, which some of you know, and some of you might be coming to this for the first time. As Katie mentioned earlier, we commissioned an evaluation, an independent evaluation, which reported back to us just as we were heading, I think, into the first wave of the pandemic. And since then, we've reviewed the findings, and the key findings appear on the left of your screen. Katie's already mentioned a couple of things in terms of the scoping phase, the increased importance of equality, diversity and inclusion. And what's been happening in the period post the first wave of the pandemic, when our team started coming back together and working on this piece, are various updates to the published guidance, and some of you will be familiar with that. We've updated that to better reflect that scoping takes time, that actually you do need to prepare the ground, engage key people, and spend time really planning rather than just attempting to run some diagnostics very, very quickly. Laying the groundwork really is hugely beneficial to organisations. And then I think one of the other major important elements is the development of the sixth cultural element on equity and inclusion. I think both the evaluation and the experience of the team to date had highlighted that although equality, diversity and inclusion had been embedded within the support and compassion cultural element previously, it was easy for organisations to miss it. So the evaluation, and then I think quite honestly, our experiences of working through the pandemic and the disproportionate impact that had on some parts of our communities and some big sections of our workforce meant that we really were serious about reviewing our focus on equality, diversity and inclusion. And that is reflected in the tools, guidance and templates that we have or will be publishing shortly on the website that Louise is going to be telling you about in just a second. So a lot of our guidance has been updated, but also what the evaluation and the experience of the team to date has taught us is that how we work as a team really can have an influence on how helping organisations engage with this work. So next slide, please, Shauna. And the next slide is really just to reiterate that for us as a relatively small team, as of yesterday, we were +1. Ruth Evans has joined us from Royal Cornwall, so we didn't manage to get her picture up here just yet. But as a team, as we responded to the feedback from the evaluation and the plans we put in place to address that, every member of the team has played a role in terms of taking responsibility for significant chunks of the work and seeing this through to fruition. And I want to emphasise that because actually how we do our work as a team really matters, in that we want to really genuinely model the collective leadership approach. So no matter what somebody's role is within the team, everybody has played a role in terms of taking this work forward in various important ways. And if we move on to the next slide, Shauna, this is our exciting new graphic, drum roll. So for those of you who are previously familiar with the work, as I've mentioned, there were 5 cultural elements. We now have 6. Equality and diversity actually appears as our 5th cultural element now. It isn't just tagged on at the end. And in terms of the new design of the programme, the sort of look of it going forward, what we've really tried to do is to marry that with what the People Promise actually looks like visually. So there is some sort of read across there. And then moving on to the next slide, this is where we see the 6 cultural elements broken down, and there's a lot going on here in this slide. This is the conceptual framework, and this underpins the entire culture and leadership programme. The tools that Louise is going to be talking about in just a few moments are all underpinned by the cultural elements that you can see on the left there, and they're now expressed as being in support of performance and also people, because both of those orientations matter. As part of this work, we have a series of leadership behaviours that align to those cultural elements. And just to say that shortly, the Leadership and Lifelong Learning team from NHS England will be able to publish the Leadership Way, which was previously known as the Leadership Compact. And again, what we've done is mapped those leadership behaviours to what's happening with the Leadership Way. And of course, all of this links to outcomes that relate to quality and value, performance, motivation, improvement. And then the other thing to mention on this this slide, which really is the foundation of the programme, is that this work runs at various different levels. It is about how those cultural elements and behaviours play out at individual, team, the leadership level within organisations, the organisations themselves, and then across systems. So this model works in a variety of settings. And for those of you who've said, oh, this work in my context, we'd be delighted to have a conversation with you about that. I'm now going to hand over to Louise, I believe, who's going to say a little bit more about this work.
Thanks, Sue. And if I could have the next slide, please, Shana. So thank you. So the experience of the team working on the programme, and certainly highlighted in the independent evaluation we had, was, as Sue said earlier, that preparation for this work is vitally important, and particularly engaging a broad and diverse group of colleagues with the involvement and support of the board, and getting that at an early stage is absolutely crucial. So we've therefore formalised the scoping phase so that real focus and attention can be paid to that before you start moving into the discovery phase. Previously, elements of it were within the discovery phase, but this has now been formalised as the fourth and initial phase of the programme. So that provides you with a structure for what you need to do to consider to begin your journey, thinking deeply about the purpose of the work. Why are you wanting to undertake this in the first place at all? What are you aiming to achieve? And what is your vision for that work? So the scoping phase is also where you secure your board support and recruit to your change team. And it's really important that that change team really represents the organisation, so that it's diverse in every sense of the meaning. If you're on multiple sites, that those sites are represented. If it's multiple professions, you've got all those professions represented, as well as different ethnicities, different genders. Really kind of take a really diverse diagonal slice through the organisation. We had a question in the chat earlier about crossover with the Civility and Respect programme, and I think it's important here to kind of touch on that, because we very much sort of see this as kind of a wraparound programme. When the culture is right for your organisation, and when that's in a good place and it's compassionate and it's inclusive, those other interventions such as civility and respect, health and well-being, retention, etc., can really start to gain ground, where previously they might not necessarily have achieved quite what you were necessarily hoping to. So, for example, in the discovery phase, you might draw in some of those diagnostics, like your workforce race equality standard, your workforce disability equality standard, health and well-being framework diagnostic, all those sorts of things that help you understand what is it like now. That's where you draw that into the discovery phase alongside the 6 tools that we've got as part of the programme, to really understand what your starting point is. Where are your dark spots? Where are your light spots? Where do you want to build on stuff that's already working well? And where do you need to make improvements? So, and then when you move then from the discovery phase into the design phase, you can really draw on expertise such as civility and respect, freedom to speak up, retention, or health and well-being, safety, draw all of those into the design phase, because that's really where you look at what you're going to do now that you know what you've got. What is the strategy you're going to implement? And then once you've got your strategy, you move into the design phase. And you'll notice that we've set this you move into the delivery phase, where you actually put that strategy into action. Once you've gone through the cycle once, we're actually now seeing organisations go through again and cycle round those 4 phases, because we know that culture work is never really done. It's never finished, because as you start making changes, the context changes. And it's also important to understand and check whether those changes you're making are having the desired impact. Are there any unintended consequences, positive or otherwise? And do you need to review the vision for the work? Does that still feel relevant to your organisation given that new context? Can I have the next slide, please, Shana? And as Sue said, we've got 6 tools or 6 discovery areas that we use. We've got a number of templates and resources to support you here. And we just wanted to kind of highlight some of the key changes that you might see for those of you who are familiar with the programme, and give you some assurance for those who aren't. So, for example, the culture and outcomes dashboard, we've actually added additional metrics so that we can really adequately give a snapshot of all 6 cultural elements. So equity and inclusion wasn't included as a separate element before. It was part of support of compassion, and we've drawn that out as a sixth cultural element. And just to reassure you, a lot of that data is data you already hold. It's just held in a number of different places. So this helps you to collect it in one place and understand your organisation. We're in the process of building that into Model Hospital as well. So hopefully in the not too distant future, you'll be able to go to Model Hospital and see your organisation's dashboard available to you there. Patient experience is a really important part of the programme and understanding that. And so we've modified some of the questions and increased the emphasis on engaging with patients via existing internal mechanisms and the use of focus groups, which is similar to what we've done in the focus groups as well, making sure that questions have been revised to reflect equity and inclusion. But also we wanted to make sure that facilitation guidance was updated, because we want to make sure that change teams feel safe and capable of having those conversations, which can sometimes be a bit difficult. Having conversations about how equitable is our organisation, how inclusive is it? So that's really, that's what we've done with that one. The leadership workforce analysis already sort of sufficiently covered a lot of the aspects, because it was looking at workforce planning and whether you have the board and the leadership skills capacity within the organisation to deliver on the vision. But actually what we've done is updated our user guidance to make sure that that tool can be used more effectively. Leadership behaviour survey has increased from 10 questions to 12, again making sure that support and compassion and equity and inclusion are both explored more fully. And we've also updated questions in the board interviews to reflect inclusion as well. We have the next slide, please, Shana. So just to give you a bit of an overview, we now, in addition to these new resources and new materials, have a new national support programme, because we're really keen to make sure that we support you in a number of ways to help you to achieve the best of your ability in the organisation and really have a positive impact on your culture and make it a compassionate and inclusive workplace for everyone. So we've got a new learning network, and we'd love to for all of you to join us in that network. We've got our first learning event at which Professor Michael West has agreed to speak on the 14th of October. So please put your date in the diaries for that. More details will be coming out soon, and we'll be using our social media channels to get more information up about that in due course. But hot off the press, 14th of October, you've got a date. We're also wanting to create an online learning space together. So previously we would have come out to individual organisations and work with change teams to develop skills and capacity to deliver on the programme, but recognising that actually there's something to the kind of flexibility of delivering online learning. We wanted to explore and develop a place for us to all learn together and also be able to network and share information together. We also know that people want to talk and engage and interact. That's what we kind of hear all the time, and particularly we find that colleagues really value the connections that we can help them make across the country to learn from others. So that kind of human connection is a real sort of theme through this work. And then also we're also on hand to provide support and advice. So do please make use of our NHSI Culture inbox. We've got the email address there, but it's nhsi.culture@nhs.net. And we're also on Twitter and Instagram with a growing network of colleagues on there as well. So we'll be posting news on those channels. And if we have the next slide, please, Dieter. Oh, sorry, not Dieter, Shana, sorry. So this has been my pride and joy for the last few months, building our new culture resource page, which has gone live this morning. I am absolutely thrilled to say that this is available there. It is growing and evolving and developing, but this really takes the resources as we had them. We've got some of the updated resources on there and more will be coming. But also we wanted to really have a space that spoke to the ethos of our work. We want it to be a really human space. There will be more developments happening to this, but I would really love your feedback. I'd really love to know what you think. Does it work for you? If it doesn't, please let me know. If you really like something, please let me know too. And we want this to kind of become a place where we start to share your stories. So we're producing a range of resources to share learning. You know, those will be video case studies as well as written case studies. So if you've got a story to tell, again, we'd love to hear from you. And I think without further ado, I'm now going to hand back to Sue for a conversation.
Thank you very much, Louise. I'm trying.
You just
popped yourself on mute. You're back.
Right.
You've gone again.
Okay. Apologies for that. I don't know what's happened there. But let's move on. Thank you, Louise. We'll answer any questions about the materials after the session. But without further ado now, I need to introduce a couple of people who've played big roles in creating their change teams within their organisations and leading the culture work within organisations. So first of all, we have Alfredo Thompson, who is from North Middlesex University Hospital, and hopefully we can have Alfredo on camera. And also Abby Blake, who's Interim Director of OD for Mid and South East Essex Hospital Trust. And they're going to join me just for the next few minutes, just to answer a few questions about their experience of working with this programme and the tools. So first of all, I'm going to go to Abby. And Abby, can I ask how within your organisation you got started with the work, and were there any tools that were particularly helpful?
Thanks, Sue. So we at Mid and South Essex is a newly formed trust. So we merged from 3 acute trusts in Essex in April 2020. So our culture programme was started to kind of help support the merger, as well as responding to the other needs that there were in the organisation. So we had our plans and everything signed off in January 2020, and then COVID happened. So we adjusted those plans to think about having more of a wellbeing support alongside them. So we kind of reevaluated our plans at that point. So we did, instead of having a traditional change team, we set up a peer support network. So what we call our MSE Buddy Network, we set it up in collaboration with a colleague from the Tavistock and Portman Hospital to make sure that we had the psychiatric support in place to ensure that as our team was going out, the network was going out doing the work, that they could have wellbeing conversations with staff and peer support conversations at the same time as being a vehicle for our culture change work. So that was kind of a big difference in the way that we used the change team. We also had the challenges of trying to do some pretty significant staff engagement. Apologies for the person who's joined. So we had a really big challenge around how we go out into the organisation and engage staff meaningfully and authentically whilst we have a global pandemic. And we're a hospital with kind of red zones and green zones, and very quickly, no green zones. So we adapted. We knew that we weren't going to be able to do focus groups in the way that we wanted to do them. So we've continued to use buddy conversations as a source of that kind of really rich data. We also did the board interviews slightly differently as well, because we had essentially 3 boards coming together into one. So we had a lot of people to interview and had to adjust the questions slightly to think about people who were potentially not on a board, but were still actively involved in decision making and senior leadership for the organisation, because we had a different setup. So we've also found the leadership behaviour survey incredibly useful. So it showed what it shows most places, right? Which is that everyone thinks that they're a great leader, but nobody else is. But the real kind of benefit of it really was the free text responses. Gave us such a rich source of data And one of our intentions behind doing this piece of work was to develop a new set of values and a behaviour charter for the new organisation as it is now. And that data and the engagement around that has really given us the language of our staff to use, so that we know that what we're putting back out to the organisation will reflect what they're telling us meaningfully. So the other aspect, the other tool that we really kind of took and developed a bit further was the dashboard, the culture outcomes dashboard. Somebody mentioned earlier on, I was part of the culture team. So when I moved into my role at MSE, I was able to kind of bring that learning. So one of the things that we did was take the dashboard, which I think the team will say, to be fair, needed some kind of visual development. And whilst it's the metrics in it are so useful, actually application of the dashboard and helping other people in the organisation to understand it, I wanted to do a bit of development around that. So we worked closely with colleagues in teams that deal with data a lot more than I do, and they helped us develop that. So we've got something that now we think that can be usable as a live dashboard that we can update with the annual and more regular data and use to make decisions and direct focus and that kind of thing around our OD strategy as well. So that was really helpful. I think what I would say is going from 3 trusts of kind of 4,000-5,000 to being, having about 18,000 staff, it was really challenging to think about how to do the engagement in a meaningful way during everything that was going on. We did do some fun things. So we had in August, we did an ice cream event where all of our different sites had free ice cream for the day. But whilst they were queuing up for the ice cream, socially distant, of course, whilst they were queuing up for the ice cream, we made them tell us stuff. So we gave them questions to answer and we talked to people and so that we could get that kind of actual in-person interaction. I would say the areas that we didn't explore as much from the tools were around patient experience. That became very challenging to do any kind of fresh patient experience. We of course use data, but that's something I think we need to look at into the second year of our programme. And the leadership workforce analysis. We knew that we've got a big piece of work to do around talent management, so that feels like a next phase thing for us. That's kind of the how we've used the tools. I think I would say that the probably the biggest impact is our change team, right? In terms of sustainability going forwards, the interviews and all of the data that we got through the survey and what have you, very useful, and hopefully we'll come back to those things to refresh our understanding of culture when we come to do that. But in terms of the sustainability and the long-term impact in our organisation, I think that the Buddy Network has made a huge difference.
That's brilliant, Abby. Thank you. Loving the idea of Ice Cream Day and also a guest appearance from a furry friend there, which is marvellous. Well, welcome, furry friend. So, of course, Alfredo now has to compete with that. And actually, one of the things I think the team here learned over the years, Abby, was very much around the importance of the change team. It's not just about tools. It's about how you work with them and who you use to who you work with as you implement them. So Alfredo, can I bring you in at this point just to say a little bit about how your change team worked and what you actually did to build in genuine inclusion and make sure that you got a change team that was diverse.
Thank you very much, Sue. And I also have a little furry friend in the background, so if you hear noise, I do apologise. In terms of our change team at North Mid, I think just to set a little bit of context, so North Middlesex is in northeast London, or north central London, apologies. We have just about 4,000 staff about 68% of us identify as ethnically diverse. So we're probably one of the most ethnically diverse NHS organisations out there. So it was really important for us when we were selecting the culture team to make sure that we had representation. We originally went out for 20 slots, and we were very surprised that we had over 50 people wanting to attend. So based on the applications that we received, we then had to make sure that we segmented the organisation and the participation on the culture team based on staff grades, staff professions, as well as all the other protected characteristics. It was really, really important for us to get the voices of as many people as we can participating in the different activities during the diagnostic and design phases. What was really powerful was being in a room really early on, and it was the only time, and Abby was there because Abby was helping us centrally as well in terms of NHSEI, when we all agreed that that was the only time we would use our job titles because everybody was important. So we did that once in terms of contracting the team, and then we had lots of really important, healthy discussions around staff experience, around the culture in the organisation. And our culture team is comprised of a healthcare support worker, all the way through to a consultant anaesthetist and now a consultant pediatrician. So as we progress in terms of sustainability of the group, we have more people who want to participate and make the change a reality. I've seen a number of my colleagues are also on the call. So if you're interested as well, more than willing to expand the group. So please help us to change and shift the organisation.
Okay, so just a follow up for you there, Alfredo, how are you managing to sustain the change team and how are you keeping it sort of fresh, engaged and diverse?
North Mid again was probably one of the most impacted hospitals in the country when it comes to COVID. So a lot of the work that we did, we had to park for all the right reasons. It is about me walking the floor and being really visible and maintaining contact with lots of the team members. But it's also about me being a conduit between the culture team and also the board, and also making sure that the discussions and the agenda and the priorities actually keep on happening in the organisation. I think contextually, somebody mentioned it earlier, it is about making sure that we move with the context of the organisation. We're just embarking on our continuous improvement process, and it's what we found and what we've noticed is that by aligning ourselves to the continuous improvement methodology, the whole culture agenda has taken a new life and has taken off new momentum. So I think one of my proudest moments in the probably 2+ years that I'm doing this is having the staff survey being published and the chief finance officer running to the office asking for the results for his directorate of the staff survey. And I think that in itself says a lot, that, you know, being in meetings where the chief financial officer or the chief operating officer in our case is talking about culture and talking about it as eloquently, as passionately as we are, is a real testament to that.
Okay, thank you so much, and great to hear about your finance director being so enthusiastic about the results of the staff survey. So we do have time for a few questions, and I'm just looking at, I've just been pinged what some of those questions are. So I think we'd had a question from Stephen Weeks and Abby. Would you be happy to answer that? Stephen's question was about organisations in the process of merger. Are there specific modifications to the approach when there are different cultures coming under one structure?
Yes, we had lots of conversations about this. So I guess what I would say is I think from my understanding and my experience of doing this work, it doesn't matter if you're an emerging organisation or not, you will have multiple cultures going on in your organisation. So there is no one homogenous culture that we're doing this work around. So that's firstly to start off with thinking about going into this, regardless of whether you're an emerging trust or not, is to think about understanding that there will be pockets of different cultural behaviours. That's one thing. So the second thing is, yes, we did adjust it. So I mentioned about the kind of the board interviews and how we needed to adjust that, because we merged in the programme. So we started the programme and then we merged. So that was a big part of it, how we communicated with the leadership of the trust and how we thought about the impact of having kind of that different leadership approach, because we were a group of hospitals. So, and that was the other thing that is, I suppose, slightly different as well. So we've been a group of hospitals for a number of years that had started working together. So there was some joined up working already, but we definitely had to make sure that we were explicit around taking the best from the three into the one. So for us, it's not so much about adjusting what we did, but adjusting how we talked about it to people, because a thing that people were concerned about with mergers is this one place taking over elsewhere, and making sure that what we're creating, what we're crafting, the culture that we're all crafting together at MSE is our new identity as MSE, not one of the legacy organisations in kind of enforcing a culture onto another one. And that has, I think that we have been successful in that, and I think a big part of it was around that identity thing with the values and behaviours. We needed to move away from who we were before and think about who we are now as an organisation. So there's been a lot of work around new strategy for the organisation, objectives which are for us now as one trust, values for us as one trust.
Yeah, so genuinely creating that sense of this is a new entity. I think many of us have had that experience, haven't we, of merging, and it can feel different. I
was just going to say, the other thing that my team has done is there's with the move to a new operating model, we made sure that there was OD support wrapped around that, so that people going through the process of merger and restructure and that kind of thing have some development around their new roles and what have you once they've moved as well. So that's something that is linked in with our culture team as well.
Okay, again, if people are particularly interested in that aspect, would you be happy to share some of that experience after this conversation, Abby? And possibly we could glean some more for our new shiny website. So thank you for that. Alfredo, I have a question from an old colleague, apparently, Shireen, who asks, how much exposure and interaction do the culture team have with board members, and how is the work championed by the visible leaders within the organisation?
Oh, thanks, Shireen, and great hearing from you. Shireen was also part of our culture team initially. It was really important that the culture team has continuous contact with the board. So I remember we had to prepare what's called fairly junior staff in order to interview the board and to sit and have conversations with the board. I think the board at that time and still are quite open to having that contact. We made sure that members of the executive team were at most of the events that we held initially. Whether at the start or the end of the event, it was really important for the executive team in particular to be there and to answer the questions and to really hear it firsthand in terms of some of the experiences and stories that our staff had experienced and were telling. It's really important moving forward as well that for tomorrow, as an example, the interim chief executive is meeting with the culture team just to talk about, what our priorities are over the next 6 to 12 months and how the culture team plays a role in that. The culture team is really important because what I've seen is a shift in terms of decision making, particularly around the people agenda. So we went from we'll make the decisions in a closed room to, well, have we tested the ideas out with the culture team? Have we tested these initiatives out with people who want to participate in the process? So one of the real life examples is around, we've just created a new what we call a recruitment charter, which is all based around fairness of the recruitment process. So we have an issue with fairness in the organization, is one of our cultural priorities. We came up with initiatives and plans, and the chief executive challenged us, hold on a minute, before we implement this, I want to hear it from the culture team that they think this is a good idea. I want you to go out and test it. I want to speak to them myself. So it's really important to have that visibility and that contact continuously.
Okay, that's wonderful. I think we've got just a couple more minutes before we need to move on to the next section. And I'm just seeing if we've got any further questions. I think to both of you and to Alfredo first, in this case, we know that culture change, genuine culture change, takes time. What one piece of advice would you give to anybody starting out on this journey?
Oh gosh, I think it's just remembering that. I think it's just remembering the fact that you may get pressure from your executive team if they really don't understand the process. That this isn't overnight. This will take time, and I think the other advice is to learn to balance the politics. How do you stay true to the lived experiences that you hear as part of the diagnostic phase, while theming that so that it doesn't create antibodies? So it really does take that balancing between being authentic with what you're hearing and feeding back without losing it, really.
Okay, and is there anything that you'd add to that, Abby?
I would say that if you're doing this work, you just need to get used to being pretty uncomfortable. And that's my main takeaway from this. And I remember when I was supporting other trusts too, that was the main thing I used to say to people: get used to being uncomfortable, because you will have to say things to people about their behaviour that you would not normally necessarily be the person who's having that conversation. So if I could give any advice, it would be get a really great coach and some really great support in your organisation. Find the people who think that this is a great idea and talk to them a lot, because a lot of people will say it's not a good idea. People will say you're being too slow. People will say you're not being specific enough about the impact you're going to make. People will tell you, we've done this before, it doesn't change. So support internally is really important, but also support externally from colleagues who are doing this work elsewhere, because it can be pretty lonely. And so, yeah, get some support, talk to your colleagues who are doing this work elsewhere, and make sure you've got the internal support.
Thank you. And I think that's one of the things we want to do through promoting this learning and support network, that actually there are people who are doing this work on the ground, such as you guys, and you can be a really valuable resource for each other. So thank you. And I think one of the things, comment there I've seen from Helen Mancini, who I know is from Nottingham, and we were very sorry that Tracy couldn't join us today. But Helen was basically saying, hold your nerve when it comes to doing this work, hold your nerve. So thank you for that, Helen. There are other questions that we will answer via various channels, social media, and frankly, Lord knows what else. But I just wanted to say, Alfredo and Abby, and indeed Abby's little dog, thank you so much for joining us this afternoon. I think from what I'm seeing, people have really valued your contribution and insight. So just thank you so much. So Shana, if you could just put the next slide on, please, before I hand over to Em. And just in summary, essentially earlier today, Ronke and Katy talked about the People Promise. And we firmly believe that actually this programme is one of the mechanisms for bringing some of those people promises to life. And we've just got 4 quotes here, and you may recognise the organisations and the individuals who may have uttered those words. But you know, we really firmly believe that the Culture and Leadership Programme means that actually the People Promise can genuinely be locally owned and understood. So there's lots of learning there for us in terms of how to bring the People Promise to life. I shall say no more at this point other than to say thank you again. And at this point, I will hand over to Em.
Thanks very much indeed for giving me the closing comments, which is a real privilege. I hope you can hear me. Sue, can you just indicate that people can hear me?
Yes, we can.
Perfect. I'm just going to keep going. Okay, so I have been able to take in most of the session today, which has been fantastic. So first and foremost, a huge thank you for joining. My name is Em Wilkinson-Bryce. I'm the Deputy Chief People Officer for the NHS, and I can't quite rival Maggie with her 39 years of wearing an NHS badge. I feel like I'm a baby. I'm on my 32nd year of wearing an NHS badge, and I feel equally as proud and privileged to have worn it for every one of those years. Ronke set out at the beginning of this session to inspire and motivate people, and I'm really hoping that you're going to leave this session with a fire in your belly to engage in this work if you're not already doing so. And we've talked a lot today about the People Promise, and I make no apology for that, actually, because that People Promise has been created for the NHS by the people of the NHS, and there were hundreds and thousands of people who contributed to the making of the People Promise. And those are the 7 themes that people said they needed to be true. Which would mean that all 1.4 million of our colleagues feel treasured, valued, and can really thrive at work. So Michael said that we can't go back, and I absolutely agree that the only way to go is forward. And I guess for me, some of the reflections about why we must go forward and why we need to go forward together is that we've heard that culture correlates with performance. And healthy cultures enable organisations to adapt. And, you know, nobody could possibly say that over this past 18 months, the NHS has not adapted. In fact, I would say it's adapted like never before. And more change is going to come. And we should welcome that change, because we've still got the long-term plan as our kind of true north, if you like. That's what we're trying to achieve for the NHS, which will mean that we reduce health inequalities across the country. It means that we will have a workforce that delights to come to work. And, you know, we shouldn't shy away from using words like joy. It should be joyful to come to work. And so how we create cultures that make it so has to be some of the most worthwhile work we could engage in. We know that we need to prioritise, and there's a phrase that I heard about a year ago, which I have adopted, which is let's not try and boil the ocean. So Maggie talked about prioritising and ruthlessly prioritising to a few things that will have the biggest impact, and I think that's absolutely right. There's also something about our leaders, and our leaders set the tone and are strong influencers of culture. So how we pay attention to leadership is also incredibly important. So you've seen in the chat box that the team have launched a new website. Please do go on there and find the email that is there so you can contact the team. Join some of the communities of practice. I think hopefully what you've also heard is that this is a joint endeavour. And I also heard from the last 2 speakers, it can be lonely work, and it needs to be work that you have a hold your nerve mindset about, but you don't have to hold your nerve on your own. There are lots of people who can gather together and give that resilience and that strength to come together and support each other. So I really hope that you've enjoyed the last couple of hours, that it's been helpful, that you do feel inspired, that you do feel motivated, and that you feel that actually this is work you do want to engage in, because actually creating the culture that we all want to see and that we all want to sign up to and be proud of is certainly the work that makes me bounce out of bed every morning, to use Maggie's phrase. So huge thank you, and I really look forward to working with you over these next months and years.
Thank you, Em.
Ronke, you just muted yourself.
Ronke, you're still on mute.
And they can...
Ronke, you're still on mute. We're clearly having exactly the same thing happened to me earlier. So I think Ronke, while she sorts herself out, I think she's now back online. Go for it, Ronke.
Yeah, sorry, I think my mute button kept coming on and off. I'm thinking you can hear me now. I'm hoping so.
Yes, you can. We can hear you, Ronke.
All right, thank you. So, thank you so much for your closing remarks. Thanks for letting us know that we need to move on this journey, and why this journey is really important to the workforce and to the NHS as a whole. There's so much nuggets and so many feedbacks we've gotten from here. It's very encouraging that people have found this as a very insightful session. And for us, it's just how we want to move forward and continue engaging with you post this session, developing communities of practice where we can learn together, share together, and develop best practices together. And without further ado, there are different ways where you can communicate with us on Twitter, on Instagram, and through our email addresses. We look forward to engaging with you in the future. Enjoy the rest of this evening. Thank you, everyone.